All right, hi. Today I'm going to present the California Bridge Program at Scripps Mercy in San Diego. My name's Tanya Popoff. I work at Scripps Mercy as a substance use counselor for the California Bridge Program. And I'm going to go over how the program works to help patients get access to medication-assisted treatment for opioid use disorder. So the Bridge Program works to ensure that people with substance use disorder receive 24/7 high-quality care in every California health system by 2025. And the program is addressing opioid use disorder as a treatable chronic illness. And it's trying to meet patients where they are and help them link to outpatient treatment. The program is also funded by the Behavioral Health Pilot Project. Scripps recently received a grant to start the program at the other hospital sites. So that includes Green, Chula Vista has already started it, and La Jolla and Encinitas. And they'll probably be starting up this program sometime next year. And the grant's funded through the Department of Healthcare Services, and they work with the California Bridge Program to support with training, education, and assistance with data collection. So the California Bridge Program was established to provide evidence-based treatment to people who use drugs in acute care settings. Hospitals and emergency rooms serve as the primary access points for medication-assisted treatment and harm reduction. And some of the goals of the program are to reduce harm, mortality, readmissions, and link patients to outpatient addiction care. The Bridge model is comprised of core elements, including less barriers to access treatment, de-stigmatization of substance use, linkage to community providers, and active support and follow-up with patients. So one of the core elements is treatment. So the program works to ensure that patients start medication-assisted treatment and continue the medication if they are admitted in the hospital. This harm reduction approach in hospitals support increase in providers with X waivers to prescribe. And Mercy San Diego has around 40 X waivered providers, and Mercy Chula Vista has at least 12 from my last count. And patients are provided with access to medication when they are discharged from the hospital or ER and connected to outpatient MAP programs. Another feature is changing the culture in the hospital. So the hospital focuses on helping patients be more open with their substance use and to request treatment by avoiding the use of words that promote judgmental overtones and stigma and stereotyping. So an example would be using the term person or people who use drugs or with addictive disorders or disease to give identity to individuals as people rather than labeling them by their illness. Also using the term patient to accurately refer to a person who is being medically treated for an addictive disorder. And then with connection, my job and my role in the hospital as a MAT counselor is that I work throughout the hospital with identified patients to provide brief counseling to increase motivation for change and education on medication-assisted treatment. And this includes helping the patient schedule an intake into a MAP program that's best fit for their needs. And I also follow up with the patient as needed. Wait, did I do that? So principles of harm reduction. So we're trying to humanize addiction by building support for programs and building empathy that we have for people that we serve in the hospital. Using person-first language, such as people struggling with addiction, instead of using addict or substance abuser. We're also trying to normalize harm reduction, and we're recognizing the role of harm reduction in all of our lives. Everyone needs to be healthy and safe, just like people who ride bikes need helmets, people who drive cars need seatbelts, and people who inject drugs need access to medication to help them. And also trying to dispel the myths. So just realizing that harm reduction programs aren't about increasing drug use, crime, or just using drugs overall. They're cost effective and they reduce HIV transmission and connect clients to drug treatment and other important services. And this is just like an overview of some of the myths that are out there right now. So common one I always hear, especially from patients, is that MAT is just trading one addiction for another. And I disagree with that because not using any medication has the highest risk of returning to using and all the problems that come with that, including death. I also hear that they want to use MAT as a detox drug and just short term, but the evidence shows that patients on MAT for at least 1 to 2 years have higher rates of success. Or my patient's condition is not severe enough to require MAT, or the patient feels like their condition isn't severe enough, but MAT's an effective option because it's blocking the euphoric and sedating effects of dependent opioids. It relieves the cravings, which are a major cause of relapse, and relieves the withdrawal symptoms, and the patient is able to participate in society. So medications for treating opioid use disorder at the hospital at Scripps Mercy right now, we are using buprenorphine. And buprenorphine has been used for over 30 years. It's very safe. The cost of the medication is covered by Medi-Cal and most insurances. And it's more effective for chronic pain than methadone or naltrexone. And you could get to a comfortable dose in a couple of days, usually faster than methadone, and it does not produce a high. And then there's methadone. With methadone, it's also going to block the craving and prevent a feeling of high if a relapse occurs. It's going to block the withdrawal symptoms. It does require daily dosing, and take-homes could be harder to get. It could take up to 6 months for that. And methadone is available in narcotic treatment programs. And right now, if a patient comes to the hospital, we will provide that for them as long as they've been active in and received that medication before they were admitted. And then there's naltrexone, otherwise known as Vivitrol, and that also it blocks the opioids by attaching to the receptors, and it doesn't activate them. You need to stop, the patient will need to stop using all opiates for 1 to 2 weeks before starting it. So it's not a really good option for a lot of patients unless they're coming out of a controlled environment. And it doesn't help with withdrawal symptoms or chronic pain. And it's available at most opioid or narcotic treatment programs as well. And here's how to start buprenorphine in the emergency department. So the patient would come and check in to the emergency check-in room and just tell the nurse that they're there with withdrawal symptoms and they want to start Suboxone. And when they get to their bed, they would have a chat with the doctor and tell them when they last used any opioids or other prescriptions or any substances they are actively using. And then the doctor would start them on the medication if they're in withdrawal. And if they're not, sometimes the doctor will do a home start. That's usually when they're going straight into a controlled environment like a detox program. And then I would come and chat with the patient to see about motivating them for change and to find a good fit for outpatient medication-assisted treatment programs. And then I would talk to the doctor about when the appointment is scheduled for the outpatient, and the doctor will prescribe a bridging prescription. until the patient is able to follow up with the MAT clinic. So some of the programs we work with here in San Diego include McAllister Institute, Interfaith, Veterans Village, the Crash Program, ECS, the Lighthouse, and Father Joe's Villages, and there's several more as well. And so what would happen with those programs is they'll send their patients in a lot of times to just start the medication and get that bridge prescription until they're able to meet with a provider at their facility. And these are also some health clinics that we work with: Family Health Centers, La Maestra, Neighborhood, San Ysidro, Vista. And then at the bottom, there's all the Acadia. Those are the walk-in ones that would offer methadone and the Vivitrol. So here's some data showing since the program was implemented in April 2019, we see that a definite increase in patients identified with opioid use disorder from when the program started to just this is the past April. And here's some numbers. So we see that 700 patients have been identified with opioid use disorder and over 400 treated with BUP in the ER department. So some of the benefits of MAT are to make the path to recovery easier by reducing the urge, the cravings to use, and just kind of giving the patient an option. So kind of like, try this, see if it works for you. And sometimes, if there's a positive experience, that might help motivate the patient into treatment. Taking away the psychological dependence to the substance. Medication allows the brain time to heal, and alongside with counseling, patients find that they can repair their lives and come back into society. And just overall gaining insight into their condition and how negatively their substance use has affected their lives. So in summary, we're trying to increase the number of ex-waivered providers at our hospitals, so more patients could have access to a prescription to continue the treatment after discharge. We're trying to meet patients where they're at and not leave them there. So we're including patients in treatment planning. I help them develop goals for care after they are discharged. And even if they receive case management services, so just reducing any delays that may be caused by any structural barriers. Okay, so in closing, that's information on how to contact me at Mercy Hillcrest in San Diego, and then that's the other counselor's information at Chula Vista. And basically, medications allow addicts time to develop a foundation for their lives, seek out counseling, and find community connections, and develop positive social networks and allow their brains to heal. And you can find more information on starting a program at your hospital at www.bridgetotreatment.org. Thank you. And now I have Ernie from Family Health Center. He's going to be talking about their MAP program.
Hello, everybody. Can everybody hear me all right?
Yeah, we can hear you, Ernie. I can hear you.
Okay. So my name is Ernie Tamila. I am the program supervisor for our behavioral health integration as well as our medication-assisted treatment program with Family Health Centers of San Diego. I'm going to be talking about our SUD services within Family Health Centers. So I'm going to be speaking a little bit about our BHI team, our Behavioral Health Integrated Care, our solutions for recovery outpatient treatment, and also, most importantly, I'm going to be speaking about our medication-assisted treatment program at Family Health Centers. So some of the treatment options available for STD services, of course, is detox, residential treatment, outpatient, and MAT. For detox, we do not have a detox program within Family Health Centers, but we do partner up with our community organizations for detox, and same goes with residential treatment. So we work with various community agencies around San Diego to offer those two services. For intensive outpatient treatment, Family Health Centers actually has two intensive outpatient treatment programs, one over at North Park and one in the South Bay area as well. That one just recently opened. And of course, we do have our medication assisted treatment program, and we do have three different sites that I'm going to be speaking about that provides MAT services. So for our BHI team, what we do with Family Health Centers is that we co-locate our STD counselors in our primary care clinics and some of our family counseling centers to increase access for STD services to patients who are in need of either individual counseling or groups. So for our BHI team, we do work with screening, brief intervention, and referral to treatment, which is the, as a lot of people know, is expert model. We do do individual counseling and group counseling as well. Group is only available at certain sites. So our process for our BHI is, of course, we do intake, assessments, treatment plannings, groups at some locations, but most importantly, we do regular individual one-on-one counseling. So STD services are co-located at, right now we have STD counselors at 14 sites. We're including another site over at Sweetwater, and we're currently looking for a counselor for that site as well. So we're currently at 14 sites, and we're looking to increase over the years. So for the ESPER, what we do with the BHI team is we do a lot of brief intervention. So we talk about some of the risk associated with substance use, not particularly just focus on alcohol, but all substances. We explain and educate the patients on short-term health risks, long-term health risks, some of the legal risk, financial risk, and also personal risk that's associated with substance use. Our Solutions for Recovery treatment program, this is our intensive outpatient treatment. They do promote the lesbian, gay, bisexual, transgender population, but it's also available for the general population as well. So the focus is not particularly on the LGBTQ population, it's for the general population. Services are based on the harm reduction model, and they do account for each person's unique needs as well as their level of care. Our outpatient program is approved by the county probation, federal probation, parole, and California Department of Public Health. Individuals must be at least 18 years of age or older. Most qualify for low to no cost services. Medi-Cal is accepted. It is a 24-week intensive outpatient treatment program. They do provide individual and group counseling as well as mental health therapy as well. For our medication-assisted treatment program, so MAT is the use of prescribed medications combined with counseling to treat alcohol and OUD issues. Our medication-assisted treatment for alcohol use disorders, we usually refer those to our primary care providers who are comfortable with prescribing medications for MAT. For our MAT program within Family Health Centers, our actual MAT program, our focus is strictly on the opioid use disorders. So we have 3 different sites that has the MAT program available. Our main campus, which is the Hillcrest campus right next to Scripps. We have our Downtown Connections Clinic and our Logan Heights Family Counseling Center. So those 3 sites, we have MAT services available at those sites. So our focus is to provide MAT to clients who misuse their opioid pain medications and really want help with that, and also with other opiates as well. Behavioral health services is included in our program, so our patients are receiving SUD counseling as well as mental health counseling if needed. Eligibility for a MAT program, individuals must be 18 years of age or older, Medi-Cal is accepted, and participation in supportive services is required as long as the patient is receiving their medications. We do offer group and individual counseling as well as mental health therapy as well. So our bridge program is Scripps Mercy. This is our flow chart for our bridge program with Scripps. So once a patient is identified as requiring medication-assisted treatment via the emergency department, usually Tanya will be called to screen the patients at the emergency department and ensure that they're eligible for our program with family health centers. So once the eligibility is determined, meaning that they have Medi-Cal, they're willing to transfer their medical care, mental health care, and their MAT services to family health centers. Those are all qualifications. So once that is confirmed, Tanya will give our care coordinator a call over at our Hillcrest campus, which is our main campus, and set up a bridge intake with our SUD counselor. And that bridge usually is within 72 hours, within 3 days of being released from the emergency department. Once intake is completed with our SUD counselors, we will set them up with induction for actual medication, and that occurs within 7 days of the initial contact. So pretty much within a week, the patient will be bridged successfully from Scripps Emergency Department to Family Health Centers for our MAT program. And that's all I have for Family Health Centers and SUD services. Now I'm going to be turning over to Nai Lam, who's going to be talking about services with her organization.
Thank you so much, Ernie. Hello, everyone. My name is Nai. I am a case manager over at Lawmaster Community Health Centers. And so because Lawmaster is also a federally qualified community health center, we have the same similarities as Ernie over at Family Health Centers. Okay, so Lawmaster Community Health Centers, we are a federally qualified health center. Within the clinic, we have a wellness support services where we take care of the medically assisted treatment there. Right now, we just integrated with our behavioral health unit to provide more of the co-occurring disorders that usually occurs within this population. So we have recently just switched our name from Wellness Supportive Services to Comprehensive Community Behavioral Health and Wellness Clinic. And here, where we will take care of primary care, behavioral health, mental health, substance use disorder, integrated services for families, youth, and adults. Just a little background about Lawmaster Community Health Centers. It's a nonprofit, federally qualified health clinic providing culturally and linguistically competent primary care and specialty services to men, women, and children for over the past 20 years. Within Lawmaster, we have 5 primary care clinics, including the Hope Clinic, which is where we are located on Fairmont and University as a cross street, where it's a homeless site. We have 10 dental suites, 4 school-based sites, a mobile medical clinic, a dental unit, a mobile mammography coach that serves Central, East, and South San Diego. And so we provide this care, on-site wraparound services, which also include social services, food pantry, housing application assistance, ID vouchers, and so on and so forth. Lawmaster, the Spanish translation for that word is the teacher. So we provide a unique level of care where residents find not only a medical home, but a family of staff and volunteers that care about their entire well-being. So our substance use disorder program was known as Wellness Supportive Services, has been providing recovery and treatment services to the community since 2016 2019, the California Youth Opioid Response funded LawMaster's expansion of services to include adolescent addiction treatment, including psychiatry, counseling, and MAT for transitional age youth, ages 12 to 24. LawMaster's mental and behavioral health program, known as Family Wellness Unit, has been providing psychotherapy services to the community for more than 15 years. And that is where we kind of integrated together to bring both departments together. So the services that we provide within our MAT program provide individual counseling, psychotherapy, case management and community advocacy, drug education and confidentiality, evidence-based behavioral therapies, groups focused on cognitive behavioral skill development, support and psychoeducation, medication management, medication assisted treatment, recovery and aftercare services, transportation services, and in-house referrals. And our team consists of psychiatrists, psychiatric nurse providers, practitioners, licensed marriage family therapist, licensed clinician, psychologist, licensed clinician, social worker, SUD counselors, peer support specialists, case management managers, and outreach specialists. So how someone would get enrolled, they would call, there's an error there, sorry about that, 619-285-7097, where they would get screened. A lot of our referrals come in from numerous different resources. So we have Tanya over at the Bridge program. We have internal referrals from the different primary care providers within our departments. And we also have other partners that we have within the community that are referring patients for us. And so they would be screened by one of our case managers to verify eligibility and insurance. And I believe Ernie mentioned this, because we are a federally qualified health clinic, that individual would have to agree to transfer their primary care services to our clinic. So although we are partners here with Ernie, if someone is at Family Health Centers and they choose to transition to LawMaster, they then will have to leave Family Health Centers and contact their insurance to make sure that LawMaster is their primary care in order to be eligible for these services. And once someone is deemed appropriate for our services, intake forms will be required. Once those intake forms are received and filled out accordingly, an appointment will be scheduled with our registered nurse. So they would kind of be assessed medically. And then on that same day, they would also be assessed by our certified substance use disorder counselor. And that will be that first appointment. And we would try to do this a fast turnaround as soon as possible. So the fourth step would then be following that intake assessment with the nurse and the counselor would be an intake assessment with the clinical staff. So that would be either the psychiatrist or one of our addiction nurse practitioners in order to receive those MAT services that they were looking for. Our program doesn't have a specific deadline as far as finishing the program or completion. So we have patients who are in our program for however long they need treatment. And with the population that we serve, we have that cycle, the stages of change, right? So somebody may go through the stages of change and they'll end up being in that maintenance stage, but then relapse may happen, or they'll, leave the program for a little bit, have that relapse, and they're always welcome to return. So that's something that we found very useful for our program. We don't necessarily discharge patients, but we kind of keep them on our list and keep an eye out for them if they are eligible for those services, and we return them back, let them return back into our program. And so the approaches that we have, we believe in whole person approach on their wellness and well-being. So we have some harm reduction models, motivational interviewing, evidence-based behavioral therapies, trauma-informed care, cognitive behavioral therapy, and as always, LawMaster's patients will continue to have access to all LawMaster circle of care. And so if someone is here, usually substance isn't their first and only issue. There may be homelessness, there may be dental issues, or there may be homeless issues or whatever it is. So we try to make sure that we give those wraparound services that we have for us. And so we have these principles here to respect individuals, encourage their growth, encourage motivation, and within our teens, follow their developmental stage to be responsive and respectful to their health beliefs, practices, cultural linguistic needs of diverse individuals, and lastly, to foster hope. And here is a large list of the partnerships that we have within the San Diego County, various different organizations, Optum Pharmacy, Acadia Healthcare, McAllister, and so on and so forth. And so we really partner within the county to make sure that if we aren't able to provide the care, someone within the community will be able to do so. And that's the good thing about these partnerships that we have been creating here. And so there we have it. This is our comprehensive community behavioral health and wellness clinic. We are located in City Heights. La Maestra is also located in El Cajon City, as well as National City. However, the City Heights location on University and Fairmont is the only location that has the medically assisted treatment program. So in the future, we are working to expand that. However, we just started 2 years ago and we're getting the ball rolling. So if you are interested, our phone number there, and you can ask to speak to me. My full name is pronounced Nai Coach Lam, just to shorten it and so you can remember. I also go by Nai. We're only open Monday through Friday from 8 to 5 p.m. So thank you guys all for your time. Right now we are going to head into our Q&A. So I know we have quite a bit of questions that were coming in there. So we'll transition into that.
Thanks, Nai.
Thank you.
So Dr. Bergamo, is there any questions for us? Or Katie, do you see anything?
Yes, there are questions coming through. We've been answering them in the chat, but we can certainly read them. And I believe everybody has the ability to speak. If you have a question that you'd rather ask versus typing into the chat, you're welcome to do that as well. One of the last questions that came in is asking about how our organizations integrate tobacco recovery services for patients with co-occurring tobacco use disorder. So at Family Health Centers, our screening tool and our case conference sheet, which is completed at intake, asks about tobacco use. That is presented to our medical team, which includes psychiatrists, primary care, nurse practitioners, and recommendations are given for certain medications for the patient. And we also have internal support groups for people, for tobacco cessation groups that we refer our population to. So that's addressed for every new intake that's coming into our program. Tanya or Dr. Bergamo, I don't know if you want to speak to the hospital, or Naya, what your program does.
Yes, we actually follow similar to Family Health Center. So there is a screening for that, and we refer over to primary care, and they have their resources available for those who are struggling with tobacco use disorder. However, we do not cover tobacco use disorder within the MAP program, so we refer to the primary care.
For the hospital setting, we usually address it if the patient brings it up as a concern of theirs. If they do say that they use tobacco products, obviously we will take the minute or two that we have in the emergency department to say, obviously we recommend against it and here are some resources for you. But unless they list it as something they're actively there for, we don't thoroughly address it in the emergency department.
Another question is asking about whether we see a need for MAT services for youth, for individuals under the age of 18 that may be without a parent. No, we do not currently provide MAT for under 18. I know the need is there in the community, and this is an area that's currently being explored. So I don't know on the hospital side, or Naya, if you see anything different or have any resources that you refer patients to.
So at Scripps, we don't see a lot of youth in general. It seems to be a higher percentage of adults. If we do have youth that come in and are requesting mat services, obviously you have to follow the recommendations as to who can be prescribed certain mat substances, which is limiting it itself. And then we obviously have a substance use team that can come and chat with the patient about what their options are, and determine, if and when we have to get anybody else involved.
For our program, so my partner wasn't able to join the call today, so she's actually overseeing the transitional age youth program. We do see the need for it. However, it gets very tricky with being under 18. Usually the youth don't want their parents involved. And so there's a lot of ethical issues there that kind of go back and forth between how much involvement we have with the family, confidentiality with the youth. But we usually work together to make sure that everyone kind of comes to an agreement, which kind of leads a lot of the youth away because they don't want that involvement with their parents knowing their business and things of that nature. But I can't speak too much on that because I don't have all that information. However, we do our best to make sure that we are taking care of the youth's needs and doing what's best for them, and also involving the parents. So we do have to have the parents involved in as a part of their treatment. So without the parent, I can't give a say so on that, but within our program, we have to include the parents.
We will make the slides available. There's a recommendation to upload them onto this platform. So once this is over, we will navigate that and get those uploaded. And then there was a good question about whether the patients can go into the ED and withdraw with no other reason accessing Suboxone. So Dr. Bergamo did answer stating that opioid withdrawal is a medical condition. So it is treated similarly to any other medical condition, including alcohol withdrawal. So somebody can present to the ED seeking Suboxone. And it looks like, Naya, this might be for you. Regarding the youth, there was an inquiry about young people who are homeless or a parent is not involved. I guess, how would you treat that individual, or maybe where would they be referred to?
I actually, let me see here, young people. So a young person who is homeless or the parent is not involved. If they're under 18, unless they are, I would say like a foster youth, there should be someone who is responsible for the child. So we would need to figure out who is the guardian or who is taking care of the child to have them involved. We cannot take care of a minor without consent of a parent or guardian. If they are homeless, we do have a homeless outreach team that would be helping. However, I haven't ran into a situation as this. Usually the majority of our population is adults, and that is the part of the program that I am over. So I have yet to run into that encounter. Sorry if that does or doesn't answer that question.
So that is, those are all of the questions that are currently in the chat. Does anybody else have any other questions that you'd like to ask?
I do not have an exact number on that. Again, if you would like, I can provide you the phone number. I can provide you my phone number. Maybe we can get some more information on that. I am overseeing the adults program, so I don't have an estimate on how many TAE that we are being seen, but we do have a good number.
All right, well, if there's no other questions, I know all of our contact information is in the slides that will be uploaded. So please feel free to contact us if you think of any questions following this presentation. And if there are no other questions, then we will go ahead and conclude this session. Thank you all for attending.
Thank you.
Thank you all.
Thank you.
Thank you.
Good job, everyone.